is one, and we will give folks a few more minutes to join.
Please enter your access code followed by the pound or hash sign. To enable audio control, please enter your audio PIN followed by the pound or hash sign. If you do not have a PIN.
Okay, so if we're hearing someone's, we will soon hear the terrible echoey feedback noise. So if you're calling the phone, please mute yourself on the computer.
Okay, mute ourselves on. Okay, I muted myself on the computer.
That sounds better.
Perfect.
That better?
You sound a lot better. Yep.
Okay.
I was actually surprised that we didn't run into any summer early vacations when folks would have a hard time calling in, but maybe they just didn't fess up that they wouldn't be on the call.
That's entirely possible.
I did hear from Jane Wellenkamp, who is planning to make it. I did not hear from Alameda.
We don't have Mary on the phone yet, right?
Yeah, no, I'm here, Jane.
Oh, hi, Mary.
How are you?
Okay, good.
Good.
So Boston's here.
Yay. And I am recording this session both because Arthur can't be here. Yay, Jane is coming in. Arthur couldn't be here today, and he helps me with the notes. And if the Boston piece is as useful and insightful as I think it will be, we could also figure out how, with Kaylin's help, to share that with folks who couldn't actually be on the call.
Sounds good.
So I'm going to give Jane Wellenkamp just a minute for her audio to catch up, and then we can go ahead and get started and see if Palm Beach County...
So are there any other cities on, or just Boston?
Denver is on.
Denver, hi.
And Alameda is in the process.
I see somebody from Denver, that's Colorado. Oh, that's Jane's on.
Yay.
Hi,
Jane?
I just joined.
Perfect. Welcome. Well, we'll see if others join us, but let's go ahead and get started. Okay. Advance. There we go. We are in an interesting phase of this Learning Lab work, still continuing to learn from what you all do on the ground, and I really appreciate Boston's willingness to step up this month and Jane Wellenkamp's willingness to step up in July to share local evaluation, systems evaluation. But also I want to speak today about the transition of this Learning Lab, where we are with the products and what I'm going to be asking you to do in the coming week or two, and trying to asking you guys to help me flesh out what the questions for further exploration are, even as we work to wrap up this Learning Lab. So why don't we start, as we usually do, with what's on your mind? How are things going? Anything that's keeping you busy, but particularly as it relates to system investments and evaluation. And why don't we go ahead and start with the Boston folks. We have two on today, Jane and Mary.
Okay, so what's interesting, and I think I've talked about this before, so I won't belabor it, but we're really we're theoretically a 10-year initiative, and we're in our 6th year. And so we're only in 3 parts of the early childhood system. We're not a large, holistic county-based or municipally based initiative. We are focused on school readiness because of the issues in Boston regarding kindergarten entry, literacy, and language proficiency. And so we've been basically, and this will be a little lead into what we're going to talk about, but we've basically been focused on family engagement of parents in their healthy, the healthy development and school readiness of their children. And we use, I think I've mentioned this before, a parent-led, parent-driven approach. The second is improving the quality of early education programs. And those are the more formal care programs. And thirdly is doing the ASQ as a universal assessment tool for 0 to 5-year-olds in the city, so that we can both have a dual generation learning with parents, but also inform policy and systems decision making. So having said all that, we convened all of our evaluators last December and said, okay, you're each evaluating the pieces you're working on, but what does this say about the overall effort to improve school readiness of all children in Boston? And we are targeting low-income children. And so that is really consuming us. And we have been focused on that as a group, and the evaluators have just been terrific since December, having monthly meetings and having actually produced out of that 2 grant applications, one of which we did not get from the Casey Foundation to fund a case study, which I'll talk a little bit about more later. But also UMass, we collaborated with UMass to just file a grant application to Spencer, all in service of getting to this point of what are we doing, how are we measuring what we're doing, and does it matter? So the evaluation learning lab is really good for us. It couldn't have come at a better time because we're really struggling to tell the story. So I would say we're pretty obsessed with it. Would you say, Mary?
Yeah, I would say that's what I was going to point to as well, that the challenges of collaborating with various different evaluators that have certain requirements that they're reporting on in certain areas, and really making it intentional so it's not just a layering on, but it's an integration of the various different strategies, and that we're conceiving how we think about our information in the same way. So that's been very rich and also very challenging. And I think we're at the point, as Jane mentioned, we've applied for a couple of applications, but we don't have the funding quite yet. So we're in that in-between stage of thinking and wanting to move, but having some limitations until the funding materializes in actually making our evaluations more integrated.
And that's on top of chasing money for the initiatives themselves, so we're busy.
Can you share a sort of range of what sort of money you're looking for in order to get started? Or, I mean, maybe it's do the whole package, but maybe it's just get started. What sort of level of funding are you seeking?
Well, I'll describe the first one, and then Mary can describe the second one. But the first one was a Casey's Innovation Grant, which is available to Casey Fellows. It was only for $30,000, but what we came up with out of the evaluation advisory group is we requested the money to do a case study to take a look at when you have multiple initiatives, multiple strategic approaches to improving outcomes for children and families, or in our case for achieving, healthy child development or improving healthy child development and school readiness among our most vulnerable children. It is constantly a challenge to figure out exactly, getting back to the impact question is, all we do is layer on those initiatives into the same community-based organizations or into the same neighborhoods. But we ourselves aren't integrating. So systemically, we're just sort of repeating a lot of problems or reintroducing problems that many providers create by not coordinating the work that they do. So we wanted to step back and say, oh, it's great that we're doing the ASQ screening. It's great that we have this good family engagement model. We're really working on the quality of the programs that the kids are attending, but they aren't talking to each other. So I don't know if that answers your question. So what we wanted to do was to do a case study of how do you take a complex, multiple-layer approach to the same issue, which is school readiness, healthy child development, and how do you integrate your efforts?
Yeah, and I would just say we're at the first stages of that. It's not that we've had an evaluation committee that has met with representatives, but not all of the evaluators have participated. And now that we're looking for questions that are common. Where's a starting point that we can begin if we don't have large amounts of funding, but there are pieces of information that we're all after. And where can we begin to ask those questions? And so that was I think what the case study was going to be about. We didn't get funded for it, but we do have the Spencer grant in now. And the Spencer grant is coming at it more from a need for integrated data. And I'll be talking a little bit more about that in our presentation, what we're specifically after. It's because we realize that we all are interested in knowing something about the families that we're working with, and that's a common point of intersection, and not only that common point of intersection with some larger data sets around the city that we want to connect into. So the Spencer grant is a $400,000 grant over a 3-year period, and it will be complemented by the PEVC, which is, Jane, what's the amount on that?
That so far is $155,000.
That's they're doing
venture capital donor group.
Yeah, and they're providing some of the technical supports that we're going to need. So it's that's a starting point. I think as we develop, it will allow us to route. We've been talking for a long time about making these connections, but you need some funding to actually be in the process, and that's what we're looking for.
And it's really helpful to have a sense of scale, that when you're talking funding somewhere between a fairly small grant of $30,000 and about $500,000 to reach a much deeper dive into data and coordination and integration. Right. I look forward very much to the presentation, just so that one of your intro raises for me, how do you sustain that energy over time? How do you keep folks sort of wowed by a healthy obsession with evaluation, which sounds like it's happening in Boston. So, but let's move on first to hear hello and what's on your mind in Denver. How you doing, Emily?
She's on mute.
Yes, now she has to find the right button and join us. Oh, nope, here she comes. Hey, Emily.
Emily, are you? Okay, now can you hear me? Sorry.
Yes, yay, hi.
Okay. That was confusing. I was on the phone and also muted the computer, so, okay, well, whatever. Yeah, we're in the end of our fiscal year right now, so it's just that frantic, last month of the fiscal year fun. But really have been in a lot of interesting meetings lately around systems evaluation, and I think that there's some renewed momentum at the state level here in Colorado around trying to finally get agreement on what indicators we'll be tracking. And then really just some local funders have released some new funding initiatives around much more broadly supporting systems work, which is exciting because it has evaluation embedded in that as well. So, just trying to kind of figure out what fits for Denver and how we kind of fit into some of the state things that are happening as well. And I invited Hannah Nichols from Civic Canopy to be a part of this call, but she might not have been available. But they're working through the Colorado Early Childhood Colorado Partnership on some of this related work. So I thought she might be able to kind of chime in at some point in the future as well.
And is some of this new, is this parallel to or really connected to the revised framework?
Yes, and so there's the revised framework is expected to be released July 9th, and then they are expecting, I think, to do a phase 2, which would be linking it more clearly to data and measurable impact, but I don't think they've found the funding specifically to do that yet, so they're kind of in a information gathering phase, but I think that is the plan. And then this Early Childhood Colorado Partnership Group, actually their vision and mission is aligned with the framework, so they'll be changing that because the framework is changing, and they're also beginning to refresh their data development agenda because there are some state-level indicators that maybe weren't available a couple years ago that now may be available. So it's kind of happening on a couple different fronts right now. And then just as an early childhood council here in Colorado, we have a kind of a new charge from the state quality improvement dollars to be looking at how we can be more measurable in our work in systems building and what that means. So that's tied to both the framework and also this Race to the Top expansion work as well. So it's happening on a lot of different fronts.
And it does, I would love to think about what would be the right time for you and Hannah and anybody to share the Denver work that really connects the local initiatives and evaluation with a state effort to do a coordinated, integrated approach. I think we can learn a lot from, and I think, again, these conversations, we ask you to do a brief presentation, but then to just throw out all your questions and to see if other folks have ideas or experience that may be relevant, because I do think the way you just described the moving foundations, but also trying to get them reset in ways that really include systems building and measurement is exactly what we're trying to learn from.
Yeah, I think we'll be ready soon. We do need to have the finalized framework, which will be here in just a couple of weeks, and that will really, I think, help us kind of know what that is. And so, yeah, I think definitely I'll connect with Hannah and see what we can kind of figure out about when we could present to the group, because there's a lot going on. So.
Yes, that's exciting. All right, Jane, speaking of a lot going on, Wellenkamp, you want to share what's on your mind in Alameda?
Sure. Actually, I was going to say I've been out of the office for a couple of weeks, so there probably isn't that much new for me to share this time around, but I'll be going into more detail about what we're doing next month.
Well, welcome back to the office.
I think I'll pass today.
Okay, that's allowed. Well, as you can hear, this is a space that's really very busy, and figuring out the best role for EC LINC in facilitating the sharing of ideas, but also what connections make sense among you guys now that you know each other and have a good sense of some of what's happening in each locality. I hope you make relevant connections directly as questions come up or ahas are discovered. Why don't we go right into the Boston presentation, which means I need to get their slides up. Look at that. There it is. It's not at the beginning, but that's okay. And I can turn it over to Jane and Mary to take us forward.
Okay, so this is Jane. Vicki, do you you sent out the matrix this morning, so everybody would have got that in Vicki's email today.
It's an Excel file, and
Right.
if you haven't had a chance to look at it, this is what it looks like.
Okay, so you're bringing that up. So you're good.
Well, I mean, thank you. I was able to show something, but now I really think this is so concrete and so precise in its focus. I think it's a wonderful model for how to look at all the various moving pieces and what we're trying to learn from them.
So we can start there, and with that matrix, and basically what this did is exactly what Vicki was talking about and what Mary mentioned, which is we really needed to have a pretty easy way of looking at a very complex set of projects. And so the evaluators, you know, basically when they came together, as opposed to the program people or the, you know, the community, they had a very clear sense of what they were looking at and what their research questions were and what they were trying to measure. And it was really after putting this matrix together, which we did relatively early, I think at the probably the second meeting in January of the Evaluation Advisory Group, it really is what catapulted us into this issue of how do we figure out whether or not, in other words, we didn't have any comprehensive or cross-strategy data. And as a result, we didn't have any cross-strategy analysis, and we didn't have any documentation of whether these strategies on their own, we probably had enough to say what we thought was happening in an individual strategy, but we really couldn't document whether or not a location like a neighborhood that had employed 1 or 2 or 3 of these strategies was doing better or not, and whether or not any of it as single strategies or integrated strategies was having an impact on systems. And yet, at the same time, and Mary will go do a deeper dive into our family engagement, but we knew anecdotally and then ultimately through interviews that the community partners were more readily collaborating with each other. We could see some of the local, you know, turf battles between, you know, generally underfunded nonprofits working with families with multiple challenges. We were seeing a lot more collaboration and beginning to agree that they didn't need to all do everything. And we're talking primarily about multi-service agencies that we work with. And we also began to see, and Mary will talk in more depth about this, we began to see that parents who had been isolated and disconnected, we actually, that was our recruitment strategy, was to use peer-to-peer outreach to identify parents and families who were disconnected and isolated from the larger community, and we were beginning to see the creation of these networks of parents. And so when we sat down and did this matrix, it really dumped us right into this complexity theory, and I think we've talked about that on the Learning Lab. Have we?
Not that I recall.
Okay. Well, the other, so the complexity, and Mary could speak to this if people have questions, but there's a whole research field about complexity and Mary, you're going to have to bail me out here, but, you know, social problems, and I think we all agree, are not linear. It's not like you tweak one piece and then, you know, if you work on A, then you improve B. If you work on B, you improve C. It doesn't work that way, we know. And so it was, you know, how do we actually, and I think this is true in a lot of human services and social problem analysis, is how do we actually pin down what is a moving target? There's always some force at work that is a factor that wasn't considered in the original research design. Its impact on you know, sort of the serve and return of what we're providing through the initiatives and what people are taking up varies from place to place and can vary from family to family. And so it was like, as the work gets increasingly complicated, then this is why we figured we had to step back and evaluate the whole picture. And so if you just go to the PowerPoint, I just have to close out. Do we have to close out the matrix? So if you go to the first slide, we then took the matrix and put it into this slide. And so you see our 3 strategies, and this just happens to be the little bubbles just happen to be the names of those programs. And then what we did is we actually tried to cull out what exactly were each of these doing. In other words, what were we trying to do in Boston Kids versus what were we trying to do in Screen to Succeed? And so, as you can see, this sort of silo impact, when we mapped it out this way, was even greater, except for, if you look at the sort of the bottom bullets, which was, if you take Boston Children Thrive and you go down to the 4th bullet, the depth of agency connections with families, and then you go over to Boston Kids, you have child-level gains, you go over to REQIP, you have impact on families and children, and again, improvement in child-level assessment. And then on the Screen to Succeed, we had early connection to services. And so across these siloed strategies, you know, ultimately we were looking for the same outcome. And so there were different inputs, there were different outputs, but ultimately, you know, the whole purpose of these strategies was to ensure that at the end, children were doing better. And because of our focus and our, you know, the value that we place on family engagement, that by a lot of what we do is, you know, the obvious entry point is families or the programs that work with families. But it really was, we can't obviously see gains for children if there's not support and resources available to the families. And for those of you who have state level, you know, funding and state level responsibilities, this is probably something that you've known for a long period of time and something that you work on as a standard operating procedure. But as a small mayoral initiative, you know, we had a laser focus from the previous mayor that we had to change the language and literacy proficiency scores upon entry to kindergarten. So we are looking in his eyes, he's now passed away and we have a new mayor, but what he was looking for was improved scores. So kindergarten entry assessment on language and literacy had to go up, the end game for us. But what we learned on the pathway to get there was that each component of the strategies that were ultimately developed, you know, created this more holistic approach, but our evaluation and research questions hadn't really kept up with that evolution, and Mary can talk about developmental
evaluation.
And so now what we find is that I think, and I said this at the beginning when we were just doing the updates, is so now we're at this point where we had to step back multiple, steps to look at this bigger picture. And we've really had, for the first 5 years of this initiative, we've had our heads, focused at the community level, focused on these individual strategies, working hard to fundraise to support these strategies. And it was only when we realized that when we were trying to tell the story of why it mattered, that we were too granular, and that we needed to step back and take a look at the overall picture of, in a larger question, are children and families doing better as a result of, this work? So what we thought would be most helpful to people today would be to kind of take one of the strategies rather than trying to go through all three, and just go deeper into the family engagement, Boston Children Thrive, and talk a little bit about how we're going to, I think, probably modify our evaluations in a way that, as Mary says, we're not collecting the data 3 times. We're asking common questions and beginning to see how we can do integration. So I'm really interested in hearing, more mature sites like Denver about, service integration or strategy integration, etc. But this is where we are, and we're learning as we go, but obviously we don't want to reinvent the wheel either. So if people are willing to bear with us for the next 10 or 15 minutes, Mary can walk us through a deeper dive. But maybe we should stop right here and see if there's some questions.
Just one resource that I want to mention. We don't have Ventura on the phone today, but Sam and Petra and Claudia and their team, after a decade of doing this, got to a point where designing an integrated data system was really critical.
Right,
right. So that everybody is putting their stuff into the same place. I love the idea of simply not asking 3 times.
Right. Well, really, but you know what? That's exactly. So that was my sort of, rough description, but that's exactly what the Spencer Grant is about. Is there's a lot of money in that proposal for the actual software development, and so I'm writing down Ventura County, Mary.
Yes,
because we need to not reinvent the wheel. But an integrated data system, it sounds so simple, and yet it took us 5 years to even, get there, to say we're holding all this data in different places for different initiatives, and we're working with the same families in all 3 initiatives. It's just, crazy making. So.
Jane or Emily, did you have anything to share about your integrated data system at whatever stage it's at?
In Alameda, we do have more than one data system where we enroll families, but it's not across all the different strategies and services. So unfortunately, it's only limited to certain strategies. But we're also working with county-level groups to identify common outcomes. So even if we don't have the data all entered into the same system. At least we're identifying common outcomes that different county agencies are agreeing to collect and share.
Yes,
They
so
wouldn't
often
be,
there's
they
a
would,
hybrid.
yeah. Yeah,
Right,
it's a
which
hybrid,
is, you know, really that was the cross, you know, by just sitting down and looking at it, it was those common outcomes that we were all, that each strategy was geared towards achieving. And, you know, we just, as Mary said, we just need to be very explicit about it and really, you know, talk about it, highlight it, communicate it. And so that's
it's an interesting endeavor, but it's you know, I think it's there's a lot of interest at the family level, and you know, maybe we should move on to the next slide. And this is, again, I'm going to mention that the Center for Social Policy has been involved with the family engagement section. So we've been looking at, in the family engagement, there were 5 original neighborhoods, and now there are other neighborhoods who are beginning to collect data and send it to us. And there's also a statewide network that always existed, and there was a relationship between the statewide network, it's now called the Family Engagement Network, and the Boston Children Thrive, to collaborate together in order to not be duplicating. And in fact, many of the core agencies were involved in both. And so to make sure that there was some commonality, in fact, there was a lot of work on making the reporting, that the reporting was the same. So they could report to either agency and it would be covered. So what we're looking at in the Boston Children Thrive, and this has changed over time, I think, as we've learned, and that's what Jane was talking about in terms of the complexity. When we see trends that are emerging, we have really shifted our evaluation to respond to those trends while still keeping some of the core elements that we're interested in. And what we're really interested in looking at is at the individual level, all the families who are getting engaged, is that making any difference in how they're relating to their children? We knew that we didn't have the connection yet to long-term to find out, do they do better in school, which is on our roadmap. But does it make a difference? Do they change any of their behaviors as they're working with their children? Has the activities and influence their parenting practices? We're also looking, because parent partner or parent leadership has been a core component of this initiative, and I would say from the evaluations in the past, it's been one of the most important aspects, that there are parents who speak the same language, who are reaching out into the community and making connections within community organizations that had not been made previously. You know, there's been inroads, but not to the extent that happened with the Boston Children Thrive. And how does this participation influence the agencies? How do they connect with the families? Is it any different through participation in the Boston Children Thrive? So then beyond that, is there any influence at a broader context, at a more macro context, beyond just the neighborhood or the neighborhoods themselves connecting? Did the neighborhoods connect more with other initiatives in a broader context within the city? So that's pretty much what we've been looking at. And you'll see the map on the right-hand side. That shows where the 3 initiatives, or the 3 strategies that Thrive and 5 is employing, where they're located. And you can see that there's a lot of overlap. So we're beginning to ask the question, and on this particular round of our evaluation, interviewing key informants who can talk about, we can begin to learn how these strategies are or are not integrating, you know, just at a basic level. And so that has changed this time around, that we're beginning to include that. We have had more connection with Screen to Succeed, because many of the parent partners who were the leaders are now the screeners for the ASQ screening in the neighborhood to look at how families, it's an assessment of children. Next slide, please.
It's actually just a screen, Mary.
Yeah, it's just a screen, right?
Just a screen.
Yeah, I'm sorry, not assessment.
That's okay.
I'm sorry. Go ahead.
Go ahead. Yes, please.
I was just going to ask you a question about the map on the previous slide.
Yeah.
So that's a map of where the service locations are, right?
Yes.
And then
are you also?
And are you also mapping where the families live who attend those service location sites?
We are with the, and that's what I'm going to get into now, the whole data collection system that we have in place, but it's not across all of the strategies yet. It's just for the families.
Yeah, we could map that. We could map their home addresses, and I think we have done some enrollment maps here and there. Mary, haven't we done some occasionally to see where the enrollees actually come from?
Yes, we have, but it's not. Yeah. We don't have.
We don't have it in this deck,
and we don't have. We have information on Screen to Succeed and family engagement.
Right.
And we've done some cross mapping there.
Yeah, we don't have the addresses out of the quality improvement.
Which is what the Spencer grant would allow us to do. So this next card is, I just wanted to explain the membership card system. I think we've talked about it a little bit in the past. And it is, on the screen you see there are 6 different sites with another potential site entering. And there's a core agency represented by the circle, and then there are partnering agencies in each community that have been participating in meetings on a monthly basis since the program began. And each site sends us information about enrollment on the family, so we get basic core information on demographics and a little bit of information, basically just demographics. And then we also get information. The families are issued a card, and it's called a membership card because it's not about the data. And if it had been only about the data, it would never have succeeded, I think. It's about belonging, and the various different hubs have sold it to the community of the families in connection with the families to varying degrees. Some of them have really taken it and run with it, and others are not as engaged with the membership card. But those who are, there are two and actually 3 groups that have been really using the data in a deep way. They send the data to Thrive and 5, and Thrive and 5 sends it to us, and we provide an analysis and send it back to them each. What used to be each quarter, and now it's semi-annually. If you come to the next slide, I wanted to show some of the information that we're able to track. I just picked a few of the slides. They get a report which gives information. On this slide, it's looking at the income of families. We don't ask that question at intake. It's an income proxy, which we've defined as either they're receiving DTA, SNAP, or WIC, DTA, SNAP, or SSI. And so we did this because in the initial program, there was a real interest in reaching out to the families that were not as engaged as other families, and to see what was happening. We were looking at this, and particularly at languages, and in some communities like Fields Corner, they were really interested in looking at, well, we want to target grandmothers because we're working with the Vietnamese community, and the grandmothers are particularly the ones who are taking care of the children. So they tracked, as we gave them information back, if the grandmothers were actually participating. So this is all of the sites. We produce an individual report for each site and then an aggregate report. And and then we compare it to all 6 neighborhoods, and the target neighborhood that they're in, and what's the Boston data that we're able to gather. We're not able to get information on all of it, but where we are able to get information that gives them some sense of a comparison to how they're doing compared to what their neighborhood looks like, which have been extremely important for some of the communities that have high percentages of public housing, but also are surrounded by wealthy communities. As they say, they've got the Mercedes-Benz of strollers next to the families who are living in public housing. So having a way to talk about it has been very important to them. And next slide, please.
Before I let you go, a quick question. Is there any proxy for resident status, whether these folks are documented or undocumented?
No, we didn't. Yeah,
we do two things. We do two things that I think are probably non-traditional, and it's probably because we are an initiative and have only private funding, so we're not required to. But we do not ask an income question. And looking at this slide, in these 6 neighborhoods in Boston, in these 6 neighborhoods, Mary doesn't have the poverty. Well, you see at the top where it says 64% of all enrolled families are living in poverty. So there's, there's 46% of our enrolled families who are not living in poverty, and there's 65% of all the enrolled children are living in poverty. And if you look at the bottom right of the gold highlight, the average income for families living in these 6 neighborhoods, which are our poorest neighborhoods or have clusters of our most economically disadvantaged families, is $67,000, which is just, sounds like, a huge amount of money. But Mary is absolutely right. One of these uses, it's the, it looks like South End, Lower Roxbury, Children Thrive. That neighborhood has some of the richest people in the city. It's the South End of Boston, which has been through a fairly significant gentrification, backed right up into one of the poorest neighborhoods, which is Roxbury in Boston. And so we have this economic, not a clash, but just a difference of those have-nots and those haves. But what's interesting is we never ask question about income, and we never ask question about citizenship. And the reason being is that some of the more isolated and disconnected families are undocumented, and we want their children to have the access and opportunities, and them to have access and opportunities to what the neighborhood and the neighborhood agencies can offer. And we don't ask about income because of the research about mixed income groups. And that if you look at the formal education in K to 12, kids in mixed classrooms, mixed income classrooms, it doesn't affect the achievement of the higher income kids, and it improves the achievement of the lower income kids. In addition to which, they're all living in proximity to each other. So that was very intentional not to ask those questions, but that was a good question for you, and I apologize for the long explanation.
No, and as we're thinking about telling the story, it may be important to be able to highlight the intentionality of data that's not collected in addition to sort of this unsatiable hunger for data.
Yeah.
That's a good point, yeah. So this next slide is just showing that, the families, when they get their cards, they either swipe them or present them to the partners, the core partners and their partners. Now, there's some question about how far that goes out, and we know that we're not capturing all of the participation of the families that are having within the community, but we're getting quite a bit of information. We've got, I don't know, it's something in the neighborhood of 25,000 entries. So we do have some good information that we can draw on. And what this is showing, it's just showing, well, you know, if you were targeting families who were less connected, and in this particular case we're looking at the income proxy, what is the relationship to their enrollment? Do they participate at more or less the same rates as families who are of higher income? And of course, you know, it's a proxy, so it's not perfect, but it does give some indication, and it's slightly less, but not significantly. So we can go on to the next slide. I don't want to go into all of the details of the reports, but I just wanted to show a little bit about what we're able to do with collecting the information. So this next slide just shows by site the number of times that families are participating. Are they coming back? And we've cross-referenced that with various different demographic information to you know, have a deeper look at what's happening in the families. And you know, about half of people who sign up never really come to a program, and that's not terribly surprising. But we are learning more about the families who are coming and are deepening their connection. So next slide.
Yeah, just to interject one thing, you know, when we looked at that participation rate, it was sort of like families enrolled, but they never attended any of the activities or, you know, that were being provided by the community agency. And so the question was, well, you know, is this just an abject failure? And, you know, how can you impact families if you never see them again, which is, we assumed we had never seen them again. But Mary's going to get into this about what the researchers did is then decided to go out and talk to people and to interview people, and UMass used a whole cadre of graduate students to go out and talk to families who had enrolled, and we began to find some sort of surprising positive outcomes that had nothing to do with how many times they went to a particular story hour or whether or not they participated in, you know, baby signs, you know, how to understand your infant, or a literacy group. So I'll just leave it at that. But it was this, again, just having this data, you know, we wanted to dig deeper into it. Do we just have activities that they don't like, and, you know, et cetera, et cetera, et cetera. So it's kind of, it's just good to have this kind of information as you're moving forward.
Well, it prompts questions too from the community, which we are, like I meet with the communities that are using the data heavily, and I ask them what more they want to know. And so we're able to produce it. And on that very question, there was some, for Fields Corner, they were guessing that it was because the families that were taking the ASQ screen were not getting the information about what was happening in the community. And she asked me to run a cross-reference on who brought the families in, and the ones that weren't participating, where were they coming from primarily, and she was right. And so then they changed the way that they did their introduction at the ASQ screening based on that. And so that
basically,
you know,
yeah, connected those families in to
right.
the activities. Yeah.
Yeah.
And,
so
and one piece that also jumps off, I'd have to think about it more, but not an uninteresting opportunity to use these folks as a control. They are connected to BCT, but they are not engaged in activities. Can you then speak to the impact? There are some impacts of simple connection, and there are some additional, possibly, impacts of participation that could be another interesting analysis.
That is excellent, yeah. Vicki. The researchers figured that out. I didn't, but that is exactly the question they've been asking.
Well, we're interviewing those families this year.
Yeah.
The ones who did not connect, because we feel like we got a lot the last year talking to the families who did connect, and we wanted to explore that that angle, and it's just it's a sampling. It's not we're interviewing the families of those groups. We've chosen 2 communities to dig deeper in that case, and we're doing the same thing with students who speak multiple languages, matching the language to make sure that we're interviewing the families in a way that that they'll be able to relate to.
This is Kaylin. One thing that I'm just going to throw in, I hope you're capturing, is social connections, because I could see a scenario where someone goes to a program of some sort once and make some informal connections with other parents there. And even if they never come back to the program, if they continue those relationships, that could be a huge benefit of participation.
Yeah,
Absolutely.
I just conducted an interview on precisely where that issue that point came up, and I think it's right on target. And we certainly ask, but it's not. We're limited in what we're able to, how many people we're able to interview, but we do get some insights through our family interviews. I do want to say too, just about the map. We do map. In the beginning, we mapped where people were enrolled, and now we're mapping where they're participating. And each site gets a blown-up map of their particular community. And the one thing I wanted to point to, which Jane already mentioned, is you see the overlapping of the dots. In the beginning, we had assumed that there would be a geographic connection, and the geographic connection is proving to be much more much broader than what we had originally thought. That particularly the communities in Dorchester and Roxbury, and one community, which is a health center, you see the dots that are spread throughout the rest of Boston that are not connected to
That's the purple dots. Yeah.
Yeah, it's harder to see on this slide, but we do blow it up to have a look at the overlap. So it's kind of interesting. They've got individual cards. We don't have any way of knowing, because we don't have the family names at this because of the IRB. We don't have any way of knowing, are these the same families that have 2 cards? Are they participating in 2 communities? We do track hub hopping when one card is used in another community activity. But we don't know enough to really understand this sort of, the borders of communities are very,
porous.
Porous, yeah.
What's interesting is that when you get at the outskirts of Boston, so if you go over to West Roxbury down to Hyde Park, up, Jamaica Plain, maybe into the Fenway, those are higher income, more middle income neighborhoods. And it's interesting to see that there are families, these are enrollees, so they have enrolled. And as Mary says, the purple is, there's a health center as the hub. Fields Corner has a health center, and that's the community agency we partner with. And so they have obviously a wider spread. But you see the black dots, which come out of Roxbury. The hub agency there is a community organizing entity called Dudley Street Neighborhood Initiative. 30-year-old community organizing, and it's interesting to see how did families down in Hyde Park and West Roxbury connect into DSNI. So it's kind of interesting to see how that works. And Charlestown is more gentrified, although they have pockets of poverty up in the northwest corner. So we have a few families out of there. So it's fascinating.
How are we doing for time?
You're doing great. No worries.
Okay. Then let's take a look at the next slide then. So we've in presenting, we wanted to present a little bit about the card system and the membership card and how that works. And I think we mentioned in a phone call not too long ago that we have an app that's in the making, and the Spencer Grant will provide the additional funding that will allow the card to be read by phones and iPads, and well, not, it's actually not the iPhone, it's the other one. What's it called? The other
Android.
phone? Android, yeah. And that's where it started, so that we can begin to make this a lot easier for collecting information. And I would say, just to finish up on the data that we're providing on a semi-annual basis, we worked very hard to work with the communities that it would be useful for them, and they in fact have stated that as funding was cut for their actual programming, that this is something that they wanted to continue to do.
Somebody muted something.
Yeah, I got an echo.
Keep talking.
Is it better? Yeah, okay. So, there's still an echo. Are you all hearing that?
I don't hear an echo.
Okay, this must be on my phone. So I just wanted to mention that that's something that the communities are using to think about who they're connecting with, and also largely for funding, and particularly for communities that have this bifurcation of income. It allows them to show that they are actually reaching, in their neighborhood, they're having broad reach. So one of the things I just wanted to say is that, you know, our evaluation is, we do a end of the year evaluation every year in which we do a lot of interviewing, and there are some emerging trends that are coming from that I think are worth mentioning. The first one is that parents are reporting that they're enhanced parenting skills, that they're learning things when they go to the play groups, and they're taking them home and they're reading more to their kids. And so that was a clear finding of our interviews over the past 2 years that we've interviewed families directly. And the other thing that I've already mentioned is that the parent leadership is actually key. It has made a shift in the way that they're connecting within the community, and I could provide multiple examples, but one in particular is in East Boston that has an Arabic-speaking community that the agencies there had never been connected to, and because they got an Arabic parent partner, that shifted their connection to the Arabic community. And there are stories in each one of the 5 original communities that point to that. And the sense of belonging, the social cohesion, which someone was mentioning, we're getting, you know, the insights into that, I would say, from the interviews that families are talking about the membership card and talking about belonging to the communities, that feeling like they're connected not only to the organizations but connected to one another, and how they're meeting new families and making new friends and talking about their kids. And I think one of the really interesting ones, it was the agencies are changing the practice. They describe it as a shift from being agency-focused or program-focused to family-focused. And I think that's across the board, that the agencies have been talking about this, that in the beginning, they were sharing information and resources and things like that, but now they're working with the same families and realizing they're working with the same families and connecting at that level, and connecting, looking to the parent partners to help them make inroads in the community that they had not made before. So that was very interesting. It was the last report that we wrote. And you see how this is spread across neighborhoods. I think the best example was what I mentioned, the Family Engagement Network, which changed its name to Family Engagement Network, and that's where the state money is coming from. And they have actually adopted a family partner model that the participants say is coming from influence from the Boston Children Thrive initiative. And there are several other examples of that across the city, like the Children's Museum that is now doing a parent-partner model, trying to engage families from low-income neighborhoods to come to the Children's Museum. So I just wanted to mention those few trends that we're seeing
in the
that are coming out of the work.
Yeah, and the last thing, and we just have one more slide, sorry. The Early Childhood Division, which is 4-year-old preschool and 5-year-old kindergarten in the Boston Public Schools, is now doing a whole focus this year on family engagement and relying on the Boston Family Engagement Network, that state-funded group that really has absorbed Boston Children Thrive, to run a conference in September. So it is, you know, the model is generating, you know, it's spreading, and we're hoping that we're able to make sure that it has the components that made it a positive impact on families. So it'll be interesting to see how they take it in without institutionalizing it in such a way that it kind of chills the organic nature of this changes in agency practices. So
this last slide is really, we produced this after the first year of working on our evaluation, and we realized quickly it was our attempt to look at, you know, when can you know what, you know, when, and we realized we needed to get a grasp on that, and particularly, and also influenced by the amount of funding that was available, where we would need to, you know, look for additional funding. And so this chart is from that time, and really, Jane, I think we've pretty much followed this in terms of the, yeah. So we're right in the, you see years 3 to 5, and what we did in the beginning year was to develop a centralized data system that looked at the community level, the 5 communities. We have that operational. It's not, you know, it's not online.
It will be.
It will be, and that's where the Spencer grant comes in. Is we realized from the very beginning that we needed to have the ability to enhance the data collection, but we're operating with what we had available at the time, and then also how much we want to make the connections with other broader macro data sets that have a lot to offer, you know, Medicaid and Boston Public Schools, and have been in conversations around that, but didn't really have the infrastructure in place to, you know, to hold deep conversations around making or moving the dime on making those connections. And we're hoping that the Spencer grant will enable us to do that and to connect to, so that we can get to children on track developmentally and ready to succeed in school. So we do have some information based on the groundwork that we've produced. And of course there's a lot of questions around making it happen, but I think we're well positioned to dive in, is where I think we are, and certainly have developed great relationships in the community, and a lot of openness to collaborating. So you know, that's, I don't know, Jane, did you have anything else you wanted to add?
No, thank you, Mary, that was good.
Okay.
And the sort of feedback loop that your time and energy invested in relationships with the community leaders and use of these analyses, whether they're deep or less deep, I think is very often overlooked and really critical to moving forward through this timeline.
Yeah. Well, the thing is that it has been an incredible incentive for people to continue to collect the data. And what we're doing in the Spencer grant is, instead of semi-annual reports, because we couldn't afford quarterly reports, is it'll have a desktop feature, and the programs will be able to go in and either take out canned reports of data that UMass has developed with the help of the software developer, and also create their own reports. So because it'll no longer be Excel spreadsheets and Access database, we'll be able to manipulate the data. It's a SQL, Mary, or something like that. So, but anyways, they'll have it at their own fingertips, and they'll have access to their own data, which they are integrating into the data systems they have back at their agencies. So.
And then for us, it will allow us to go deeper into the analysis and connections at a at a different level. So
and across strategies, ultimately.
And across strategies.
Across strategies. So. Yeah,
I think the other the other piece of it is that we would have liked the state to say, here, let's work on this together, and that's not the way that this rolled out per se, but I think that there are connections that we can make that can support a broader, or at least waking up to the possibility of making those connections at a deeper level at the community.
Well, and I want to think a little bit and then have an offline conversation with you about your relationship with United Way, because their indicators work, their data-driven approach seems to complement this almost perfectly. And if there's a way that they could invest in what you're doing in the early end of that work, there may be another efficiency and sort of better use of available funding opportunities so that you can both meet your goals.
Well, and actually the venture capital folks are United Way donors, which they designated to us.
Cool.
So the $155,000 that we're getting comes through United Way.
Okay, so that exists. Great.
Yeah, so they've already been very supportive.
It looks like we lost Emily just a couple minutes ago, almost certainly because she needs to be in many places at the same time like you all do. Jane, do you have any questions? Wellenkamp, do you have any questions or reactions?
I thought it was really clear, really helpful presentation, and I was just wondering, you mentioned, Mary, that you had some reports. I was wondering if there are any reports that you could share, or if you could share the parent interview tool that you used.
Sure, we'd be happy to do that.
Absolutely.
Whichever one we have multiple reports, and so we're happy to share anything. I think, Jane, right?
Yeah. Maybe we could just send out the third-year report, Mary. I know it's a year old now, but we could send out to Vicki, and she could distribute it.
Yeah, that's
and I'll send out the latest semi-annual aggregate report.
Yeah, and then I do think you have the interview questions at least from last year.
Yeah, we have them from this year too.
Okay. So we can send those out, Jane.
Great. How long are your interviews with the parents?
It varies, and this is something that I've found in interviewing with families too. Some of them are really short, and it's a question of trust in some ways, and I feel like we always get something. And part of, which won't come out in the interview protocols, but I think one of the most important things that we talk to when we're working with the students is helping the families to make the connection, because they don't always know the titles of what they're participating in, what organization is named what. They're connected more through people. So to try to make those connections to help jog their memory around their own participation, and so there's a lot of that too. I would say the interviews, it ranges anywhere from 40 minutes to an hour and a half.
Oh, wow.
And it's on site, mainly at the family's residence.
Uh-huh.
We provide a gift card for participation. And we also rely on the agencies to help make the connections for us. And it's challenging to make those connections too. It's quite a bit of work to get to the families, because many of them are working multiple jobs, and it's difficult to find the time.
Yeah, no, that's great. You've been able to do that.
And I have to compliment you on the richness and the clarity and the ability to make evaluation sound important and impactful. What you just did in 30 minutes is terrific. You ought to listen to the recording of this session and figure out how to what pieces of it you want to package for different audiences, because I don't think we do this enough or very well. So yes, you are speaking to an audience that speaks a lot of this language, and you don't have to do a lot of the contextualizing, but I think this has been such a rich dive into what you're doing in Boston and the really impressive strides you've made around measurement of systems impact and connections to results, to milestones and then results for children. So I thank you very much. And also, not quite intentionally, but turns out it was critical, Jane, that we postpone you to the July conversation.
Yes.
So thank you for that.
Yeah. Yeah, no, that's great.
I'm not going to keep you much longer since there are only 3 of us on the line right now. I want to share with you quickly, and of course we can discuss it if you guys have any immediate reactions. Let's see. If I go back to this agenda to remind me what it is I wanted to say. The Learning Lab methodology, and I use that word lightly since in large part we're making it up as we go along, was designed to be a short-term commitment and a fairly quick way to dive deeply into areas of common interest or common challenges and surface what's happening in the communities and become experts available to one another. With that in mind, we at EC LINC are proposing, and I will do it in writing too since I'm not talking to many of the participants, that July be the last meeting of this Learning Lab group, the Learning Lab on Systems Evaluation. As I say that, I would also certainly love to find an opportunity for Denver to share what's happening. So if the timing makes sense, if Emily's willing, I would certainly say let's find a time. For somebody from DC, it's very difficult to plan for August when my experience is everything shuts down, but I think that's less true for those of you in the real world. So an August meeting may make a lot of sense if we can make it work. But as we wrap up this piece, I will be sending you today a draft brief that I would very much like your reaction to, everything from editing to conceptually what makes sense and what doesn't, and what's useful for your constituencies and what they can learn from the work we've done. I will not, by the time you get it today, add a Boston piece, but I will certainly add a Boston piece because part of that brief is a synopsis of the work that's been presented to us. So with the brief, with the completion of 5, possibly 6 community presentations, the intent is to wrap up this Learning Lab with a very quick transition to the next Learning Lab, which will also be 8 to 10 months of discussion. Some of the ideas that have come up are around a deeper dive into indicators and how we are measuring that. Work on data dashboards and how we present this story and using what technology and also what the time lag is, what meaningful data is and how it's accessed. It will again be an open invitation to each of the member communities do you want to participate in this, and who in your community would be the participant? Not, and who plural. They're not limited, but clearly your staff capacity and time may be limited. So as I say, we're wrapping this one up. It's with the clear intention of a quick morph into the next discussion. That said, there's so much going on in this space. I would love each of you to think about, if it's not an ongoing facilitated conversation, sort of managed by CSSP staff, how can we continue to share this expertise? Are there links that make sense? Is it a quarterly touch base of this group just because you want to, not because CSSP sends out an agenda and says, please come talk to each other? And I don't have the answers to any of that, but I'm not so good at letting go of groups as relationships develop, so if this is my issue, I'll own it and move on. But if it feels useful to you guys to maintain some group identity, what shape that might take, how you do that is really up to you. Any thoughts or reactions to that description of our transition?
This is Jane from Boston. I understand the idea of sort of wrapping this one. You develop the connections between us. We have a lot to learn from each of us. But what are you thinking of focusing on in your next learning lab?
They are intended to be driven by what we're hearing from communities.
Okay.
So Data Dashboard has come out from Vermont and Palm Beach County who are interested in running with that. Folks have talked about what are the indicators and are there shared population indicators that we may want to sort of elevate, as these are ones that we're looking at collectively. If there are issues or hot topics on your mind that you think a series of conversations about would be helpful, please, please, please let us know. That's the intent.
Okay.
So you can tell me.
Okay.
And of course, in many ways, we're looking at different facets of the same body of work. So if given Boston as a small, not intensively staffed initiative, it may make, you may not feel that this is a big transition, although the group participation may change slightly because we're speaking to the same obsession around measurement and telling our stories better. Other thoughts or reactions?
Well, this might be just something that, because we find ourselves in this position, I feel like understanding from other people's experience how to bring complex data sets together, whether it's data warehousing or what people are doing in order to make those connections, would be a very fruitful conversation for me. And I think for Thrive and 5 in Boston, because it's complicated.
Yeah.
And it would be helpful to hear from other people's experiences.
Okay. No, I agree.
Agreed.
Yeah, I agree with that too.
In some ways, I just want to make sure that you all are the experts. You can speak to that at a much more sophisticated level than I can. So it may be that you say this is a conversation we want to have, and the EC LINC staff creates the time, but you really figure out how to frame it and what the questions are that will structure that conversation, because you know them better.
Well, I think part of the challenge of it is that we all have some experience, but there's a need for so many different experts in the endeavor that it just managing that alone is of interest. So your comment made me think about that, because no one of us can understand it fully.
Right.
And so.
Right.
Yeah.
And Jane, you made me laugh. We've only lightly touched on the complexity theory. I did work with somebody at CDC who was really deep into that and what it means and how you can identify fairly simple rules that speak to even very complex systems. But I always felt slightly out of my depths in those conversations.
Right. I mean, it really came up again in the evaluator group, but it's there's like a whole body of articles now.
Yeah, there certainly is.
Looking at it, so. And as long as they can pare it down or distill it down to some simple principles, that would be helpful for those of us in the field.
Right. 3 rules about how birds flock. That's what I remember best, yes.
Right.
I am going to let you go. The item about questions for further exploration is simply that is currently a section in the brief that I have not yet developed. So I will make time for some of that. I will ask you for any thoughts as you review the document, and we will spend a little bit of time at the July call talking about that, and the one that Jane just articulated about how data is managed, stored, and accessed, I think will go on that list. But I want to make sure that I capture from you, sort of looking forward, what is it that we need to be more aware of in our understanding of systems evaluation and nimble to address it. But you will see that in the brief. We don't need to spend time as we come to the end of our hour and a half. The last piece is simply that next meeting, July 22nd. Oops, do not leave. Don't do that. If that doesn't work for you, I won't be sending out a note today because I need to hear from everybody. But my hope is that we don't have to do a lot of complicated scheduling, which is where the poor toxic stress learning lab is, and we can stick with this fairly regular time that seems to work for many folks, recognizing that July has its own summer challenges. I really appreciate your preparation for this call, your time today, and I'm delighted that I was on top of things enough to record it. I think there's a lot of meat here that others will be excited to have access to. Once I learn how to do the recording, Jane, if you have any, how to share the recording, if you have any concerns about me sending it out to the other members of the Learning Lab, please let me know. Otherwise, I will certainly do that.
No, I don't, Mary, do you?
No.
No, I don't either.
Okay, thank you. This
Sure.
was spectacular. I really appreciate it, and you should feel good about what's going on.
Okay.
Your healthy obsession is showing.
Okay.
That's great
Thank
to hear
you.
about your
And
work.
Jane,
Thank
thanks
you.
for hanging in there.
Yes, thank you.
Thank you.
Bye-bye.
You'll be hearing from me soon.
All right.
Bye-bye.
Bye-bye.
Bye-bye.